Programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare, and we can be reached at 954-717-7027. We are a Medicare certified home healthcare agency located in Palm Beach County, Broward, and Miami-Dade. I'm your host, Louise Gomez. Thank you, everybody, for joining. Today we have 3 guests, and we are actually excited to have Dr. David Selzer, Dr. Nicole Cox, and Dr. Zulmary Andino. And the 2 locations are the NYU Langone Medical Associates right here in Delray Beach. The address is 16244 South Military Trail, Suite 560 in Delray Beach, Florida, 33484. And then we also have in West Palm Beach, the second location, 101 North Clematis Street, Suite 110, West Palm Beach, Florida, 33401. And the phone number is 561-365-3000. Welcome to the show. Thank you for joining us today. I'm excited to have you here, and excited to learn about the practice. I see you have 2 locations. I'm just going to kind of ask a little bit more if you can get into your education, background, training, and then we'll speak into that a little bit, and then we'll go talk about the practice.
Sure. My name is Dr. David Selzer. I went to medical school at the Chicago Medical School in North Chicago.
Okay.
And then I did my residency in Westchester Medical Center, then a fellowship in kidney disease in Lenox Hill Hospital. I then joined NYU Medical Associates to start their South Florida branch. At the time, we had 2 offices, which we currently still have in Delray and West Palm Beach.
Mm-hmm.
Our goal has always been to treat the entire patient. And from whatever perspective that is, our goal is to make that patient more healthy in order to have a more enjoyable life. One of the aspects that we started was having a physical therapy department in order to enable patients to be able to exercise more. And in this way, will always be a healthier person, because whether the issue that they're dealing with is directly a joint issue, a cardiovascular issue, an obesity issue, a nephrological issue, our main goal is always to get that patient moving and exercising more, especially in the South Florida region where we have patients who are slightly on the elderly side in the Medicare world. We want them to be able to enjoy those years as much as possible. So we want them to be able to go and do whatever they want to do, whether it is skiing, whether it is golfing, whether it is just simply going out to dinner or going on a cruise. We want their life to be as enjoyable as possible. And the way that is by being able to exercise and move without being in pain. So our physical therapy department goal is always to make them feel better and their joints to be more mobile. And that's why we have a physical therapy department led by Dr. Cox and Dr. Andino, who really take it on themselves to have patients feel much better.
Perfect. Thank you for that information. I love how it's multifaceted, because you're really treating the whole body as a person. So, and you have the ability to treat all that, where the locations, that's great for people who need that, especially seniors here in Florida. Dr. Cox, can you tell me a little bit more about, your background, your training, your experience, and a little bit more about your studies?
I graduated with my doctorate from the University of Medicine and Dentistry of New Jersey, School of Health-Related Professions
Okay, nice.
in Newark, New Jersey.
Yeah.
And doing that for a while, I decided to specialize in MDT, Mechanical Diagnosis and Therapy. That's my postdoctorate certification. And
Okay.
I also am certified in TPI, the Titleist Performance Institute, to work with golfers.
Oh, okay.
Yep. So basically, MDT, also known as the McKenzie method, the way I look at people is as a finely tuned mechanical instrument. And I view myself kind of like a mechanic of
I
the
like
human body,
that.
as you will. And I tell my patients all the time, when things are lined up properly, they work properly.
That's right.
Okay? So basically, I'll look at them, see if something's a little out of whack, could be causing their issues, their problems. And then hopefully we fix it together.
Right.
And then I want to empower the patient to go on and be able to fix themselves and manage their own symptoms in the future.
So you send them off sometimes with some exercises to do at home, maintenance at home.
And generally it's just one or two exercises.
Okay.
All right. Usually it'll just take one or two.
Nice.
I don't like to send people off. I will never send somebody off really with 2 or 3 pages worth of exercises.
Right.
I don't want them. Nobody really wants to take all day to get through their
Yeah.
exercise program. A lot of people they won't.
Right.
Keep it simple, and it's usually all they need is 1 or 2 exercises to address their issue or their condition and allow them to just
Nice.
go about their lives.
I like that. It's like you're like a mechanic. You're like the body mechanic, right? Nice.
It's a simple way to put it, yeah.
Yes. Thank you for that. And Dr. Andino, can you share with us a little bit more about your background, your experience, and your training?
Sure, and thank you again for having us and have the
course.
opportunity to talk about our practice and what we do. So I've been in physical therapy for 16 years. I graduated from Stony Brook University in New York.
Nice.
I was lucky enough to start my career at NYU Langone.
Very
So
good.
I've been with them for a while. It just opened the door for me as a clinician. It made me more aware of pretty much the mechanics of physical therapy. It allowed me to understand the whole picture, like Dr. Selzer was saying, integrating different aspects of the patient. I moved to Florida 2 years ago, so I'm excited. I was excited to
Welcome.
join the practice here. I'm a board-certified geriatric clinical specialist.
Nice.
And what that means is the American Physical Therapy Association have 10 specialties. You can be a ortho specialist, a sports specialist, cardiopulmonary, pediatric. My specialization is in geriatric. And it was a choice for me. I felt like the geriatric population is a population with a lot of layers. They have a lot of comorbidities. They have a lot of different challenges. And I felt like for me as a clinician, it was important to understand the different layers that come with treating that population. And I felt like it's been helping me a lot to make modifications in my treatment and just to really understand their situation and why not. Like Dr. Cox say, we both TPI certified. It's by the Titleist Performance Institute.
Oh, nice.
And basically we are trained to identify injuries with the sport of golf. And here in Florida,
Yes.
I feel like that's a very good asset to have,
Absolutely. That's
And-
good to know that.
for sure. Yeah.
Because a lot of golfers, I would imagine, have specific injuries, and knowing that you have that specialization in your practice is really good to know, because I'm sure they want to see the right type of physical therapist for those types of
Yeah.
ailments.
Definitely, just understanding the mechanics of the sport and understanding, in our view, the body and how the body moves. We as physical therapy, we are healthcare professionals that specialize on body's movement, right? Maintaining, restoring, improving somebody's function, making them independent. So just combining both, I think it's very helpful for the patient.
It's your personal experience, right, with your daughter playing.
Yeah,
Please
Golf?
share.
yeah, my daughter is a junior golfer. She's
Okay.
She's been
Nice.
playing golf for 7 years, so that kind of like tied the knot for me as well. I took interest in on the sport of golf, so it's been great. Another specialty that I have in NYU Langone is pelvic floor rehab. So I work with pelvic floor dysfunction and stuff like that in the clinic, and Dr. Selzer has been a great supporter of our department. And to be honest with you, just having that communication between physician and physical therapy, we can modify treatments right there. We can communicate and we can share goals. And he told me, this is what I'm really looking forward to. And we just modify treatments in the patient we see as a whole. And I think it's been great for our practice to have that communication.
I completely
When you have a patient who tells us we're going to go out to do physical therapy, that's totally fine. But the level of communication and the nuances that are able to happen when that physical therapist is in your office and you're able to sort of see them, even just poke your head into the physical therapy room and see that patient physically getting better and working with your physical therapist can make all the difference. And for the patient, knowing that
Yeah.
your physician is behind you
Yeah.
and seeing you get better also makes a tremendous difference from their perspective. That emotional connection, just saying hello in the hallway
yeah.
makes everything.
I agree. I think as a patient, coming from my point of view, I want to go to a place where I say like one-stop shopping, where I don't have to worry about, okay, I have to go to a different location and another location for physical therapy. I think people are wanting that, to make it more convenient for them to have that.
We also have a connection with the orthopedic team in NYU in New York, and
Okay.
some of our orthopedics do come down a
nice.
few times a month. And with their connections, we've also started shockwave therapy. So I want
Tell
the
us about
Dr. Andino
that.
to speak
What is
about that.
Oh, sure. So shockwave therapy is it's a new treatment that physical therapy has started doing. So pretty much we use it to treat soft tissue injuries like a tendonitis or a tendinopathy. So if I will put it in simple English for our
Yes.
viewers. So basically, if you think about shockwave therapy as this high energy sound wave, that
Okay.
when you put it in the area of treatment,
Yep.
it will increase the blood flow to the area. It will increase or release some growth factors into the area. So basically, when you have an injury like a tendinopathy, where the tendon is not healthy, by doing the shockwave therapy, it will restore that normal healing of the body.
Nice.
And we have very good results with it, with that shockwave therapy treatment.
We're going to talk more about that after our commercial. We have to take a quick commercial break, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor. We have with us today Dr. Selzer, Dr. Cox, Dr. Andino, and they are with NYU Langone Medical Associates right here in Delray Beach and West Palm. The phone number to reach them is 561-365-3000. I'm also going to give out a phone number if anybody's listening and you have any questions, you have any concerns you want to ask them, because they do so much in their location. You can call us in at 888-994-4995, Studio A, and please call in if you have any questions. So going back to that, the shock wave, that do a lot of patients get, have you noticed a lot of value that people are getting from?
Yes, we have a lot of patients that we positive feedback.
Positive feedback?
Yeah, I'll give you a quick story.
Okay. We like
hopefully-
stories.
Hopefully we'll have time for this story, but I'll try to make it quick. I had a young lady, maybe in her 50s. She was very independent, high level, liked to play golf.
Yeah.
And one day she just couldn't move her arm. She was in a lot of pain. Went to the ortho, took an x-ray. She had massive calcification of her shoulders.
Oh, okay.
The ortho referred her to physical therapy. She came to me. I did an evaluation, and I thought, based on her ability, I think shockwave therapy was great. Send it to the ortho to request a referral because we need a referral specifying shockwave therapy. The ortho didn't want to do it because we had that integrated team.
Oh, nice.
I sent it to Dr. Selzer as a referral. He did a thorough evaluation. He thought that she was a great candidate for shockwave therapy. Send it to me.
Yeah.
The 6 treatment of shockwave therapy.
Wow.
She's back playing golf.
Isn't that amazing?
She's doing everything, but the most important thing, she went back to the ortho.
Oh,
He took an x-ray,
right.
and he could not believe that all the calcifications were gone.
That's
And
a
then
great
I think
story.
he's thinking about shockwave therapy now. So we definitely, we had used it and had good feedback with our patient.
Well, that's great. Please share.
What effectively you're doing is bypassing the body's need for anti-inflammatory and steroid treatment. Because what that essentially is doing is giving the body, quote unquote, a shock in order so that the body naturally heals itself. So trying to get our patients on less medications for pain, give them more function, and decreases all the side effects of the medications. Anytime you give a patient a shock of steroids, you're going to affect their sugar control. Anytime you give the patient Advil or ketorolac or any of these medications, and please don't misquote me in saying that they don't have a role. Everything has a
Sure.
role.
Of course.
But when you're giving all these anti-inflammatories, they can have effects on the kidneys, or if you're giving a Tylenol, they can affect on the liver,
Sure.
and then people go on to narcotics. We want to stop that. We don't want our patients on so many different medications.
That's refreshing. We want to hear that as
we want
patients.
less meds,
we want
we want less meds, not more meds. So if we can find another
Nice.
mechanism in order to treat that patient and decrease their requirement for polypharmacy, the better off they're going to be.
And again, like you were saying, you had to, you just gave him the referral. You work in the office, so
Yeah,
it was so much easier, and I like that. And
Again, going back to the multidisciplinary team,
Yes.
we communicate, we listen to each other, we support each other. Another benefit from our physical therapy department, Dr. Cox can talk about this, is that we are one-to-one
okay.
practice. So
Can you explain what that is, Dr. Cox?
Well, basically, it's just you and the PT.
Okay.
All right. There are no assistants. There are no other patients.
Nice. So
And
it's one-on-one
it's your
therapy.
time, one-on-one with the physical therapist. You get their total attention. All right. They don't send you off to do 15 minutes on a bike, 15
Right.
minutes on the electric stim, and while they're treating 2 or 3 other
Got
patients
it.
in the
Yes,
same
I've seen that before.
space.
Yeah.
I mean, it's nothing more valuable than having your physical therapy
Right.
supervising you every step you take,
Right.
providing feedback, modifying, you know. And I feel like that set us apart. And I have patients that have come from other locations, and they just, you know, say like, "Wow, this has make a big difference for
I'm
me."
sure.
To have a physical therapy one-on-one the entire session. So I think
Nice.
for us that's a big you know, big
Definitely.
benefit that we have.
Yeah.
Now, quick question: because you do so many different modalities, does one need a referral to go to your practice?
No, doors open anytime.
Okay. See, because right away one would think, "Oh my God, I get all these referrals, so we can go." So that's great.
Yeah.
Nobody has to have a referral. We can go straight to the
And
practice.
that includes physical therapy also.
Right.
Florida is considered a modified direct access state when it comes to physical therapy. So somebody can come off the street for up to 30 days and receive physical therapy. If they need physical therapy beyond that 30 days, then they should follow up with
Okay.
you know, someone for a referral. But
Good to know.
yeah.
Good to know. What is the age range that you have going into the practice? Just curious if there's.
Well, we have a pediatric department
Wow.
through our
okay.
family medicine
Okay.
doctor, Dr. Volo. You know,
Nice.
most of our patients are probably 40 and older.
Okay.
I would say that's the bulk of our patient population. Not to say that
Sure.
18 to 40 doesn't exist, but 40 and older is sort of our main patient population.
Right.
I would also argue that at age 40, the aches and cranks sort of build up. When you're 25, everything seems to go a
Yeah.
lot smoother. But we're all past that stage of life, so you know.
But we do
Yeah.
see throughout the whole lifespan.
Right.
You
In physical therapy,
do.
we've even seen teenagers.
Yeah, I have pediatric cases.
Okay.
As after surgery, and I had, I think my youngest patient was from 8 years old, and my oldest is probably like 100. So
Wow.
we see in between all that.
And you know what I really like is because there's a lot of snowbirds. If I'm like living in New York and then I want to continue something, my physical therapy or my whatever I need to
Also,
continue,
because
right?
we're on Epic, so obviously any patient in the NYU system, it's extremely simple in order to connect. But other systems that we're connected to, we also can see all their records, and a lot of the local orthopedics are on Epic also.
Is that your Is that the
That's
software?
our software.
Okay.
So we're
Epic.
able to communicate very quickly and easily with other teams in order to coordinate care.
Wow. Okay. We actually have 2 minutes left. This is going
Wow,
really
went
quickly.
very-
Is there anything you want to share? Any type of anything you want to share with the audience? Or please feel free because now's your time to shine.
I would like to finish up by stating that NYU Langone is here to be part of your medical practice and your medical needs. We have a multi-specialty group. We have cardiology, we have OBGYN, we have an orthopedic department, we have a family medicine department, and we're all here to help our patients' populations by bringing the New York level of medical care
Nice.
to the South Florida region.
Nice. Thank you for that. Anything else you want to share before we go?
Yeah, I mean, going back to the NYU Langone family, Ross Rehabilitation was recognized as top 5 in the nation.
Wow.
For
Congrats.
rehabilitation this year. So we are very proud of what we do. We take big proud of patient care, and I'll hope
Thank
to see
you.
you guys all.
Thank you.
Monday.
Yeah, and people come down, they recognize us from up
Nice.
north, and they know the quality that they're going to receive down here.
Wonderful. Thank
Thank
you
you so
so
much.
much for coming on the show. I appreciate it. We'll see you next week. Thank you for tuning in. Have a great night. Bye.
Share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were